perspective. So we needed this flood of activity to really bring attention to older adults and the needs of older adults and their families, and to get all areas of the state, all areas of policy and practice thinking about and incorporating aging into how they plan for them. With a good budget situation over the last several years, created opportunity to expand existing programs, to launch new programs. And those things created real tangible benefits in the lives of many Californians. So for example, the state has made healthcare more affordable by expanding Medi-Cal coverage for undocumented older adults and increasing the income limit and eliminating the asset test for older adults and people with disabilities who qualify for Medi-Cal. The state has increased the economic security of the lowest income older adults by increasing the state supplemental payment for people that are on supplemental security insurance. The state's created temporary programs that have helped workers who provide care to older adults get higher wages and to get additional training. And the state also did temporary expansions of funding for lots of aging services programs like Meals on Wheels and others. So these are all really important and meaningful contributions that we should be celebrating as successes from these last 3 years. And these expansions and these new programs were possible because of a positive budget situation. The budget in the last couple of years included surpluses as well as an infusion of federal funds related to COVID relief and recovery efforts at the federal level. So those positive things all aligned, and happened because we had the master plan for aging and a positive budget situation. We realize now that the state budget situation has changed. But it's important for all of us to remember that our advocacy, the master plan for aging, all of that was created as a roadmap to guide state investments, not just when times are good, but also during fiscal downturns. And in previous fiscal downturns, the first cuts were often made to aging services, to home and community-based services, to long-term services and supports, to caregiver resource centers, to Older Californians Act services, and other safety net programs that millions of older adults in California rely on. So we're thankful that at least so far, neither the governor or the legislature have proposed severe cuts to core services for older adults. The governor didn't make any proposals in his January budget, and the legislature has not been talking about any cuts in core services for older adults. But as we get more information about the state's budget situation, and we have the governor's May revise coming out in just the next few days, we urge the governor and the legislature to maintain their commitment to services for older adults and people with disabilities, and to refuse to balance the budget on the backs of older adults, people with disabilities, and their families. We've seen in the past how cuts like that can just be catastrophic to older adults, people with disabilities, and their families. So we cannot go back there. We have to see the governor and the legislature maintain and commit to delivering core services to those members of our community that are most in need. We've talked about it lots of times in lots of different spaces that by 2030, about 25% of the state's population will be 65 and older. And that date's coming up just 6 years from now. So with that date so fast approaching, the state needs to deepen and definitely not pull back from its investments in and attention to California's growing aging population and growing population of disabled older adults. So I wanted to kind of set that context for today. And it looks like we do now have Kim with us. So I'm going to reintroduce Kim. So Kim McCoy-Wade is currently serving as a senior advisor on aging, disability, and Alzheimer's for Governor Newsom. Previously, Kim was the executive director of the California Department of Aging. Kim, welcome. We're pleased to have you here today.
Thanks so much. Can you hear me okay? Thumbs up all around? Okay. Thank you so much for coming to Sacramento, even virtually. As Kevin just said better than I could ever say, we need your voices, we need your presence, we need your stories, we need your expertise. It's one thing to know about the growing and diversifying community of older adults and their families and their employers and their neighbors. It's another thing to hear directly from them. So your voice matters more than ever. John asked me just to speak for a few minutes about the governor's priorities a little bit about the budget and where we go from here. And I'm happy to do that, and just wish I was in the same room with you so I could hear more for you and know the door is open for those conversations. So here's where the governor's priorities continue to be. Number one is the care crisis. We all know it, see it, feel it. It's what animated the executive order that called for the master plan for aging. It's what's powering our policies on care for older adults, developmentally disabled people, children, what's animating our policies around the care workforce, around paid family leave and support for family caregivers. We've done a lot in care, and we have a lot more to do. So the care crisis is the top of the agenda for our administration. Second, and I always apologize and thank San Diego, we're stealing this from you, it's aging well in California, aging well in community. So your housing options, your transportation options, affording where you want to live, everything that has to do with community living needs to work for all ages and all abilities. And that's going to require a big shift as we all get ready to age well here in California. And the third priority is leadership. California has been leading in aging, and we need to continue to lead in aging. We're so pleased to see a couple dozen states now have their own versions of plans. Utah for the Ages is one I just saw. We're so pleased to hear the feds are starting one in their administration. And of course, Kristen Gillibrand has a bill. I'm currently the only aging advisor that I know of, but I'm hoping that sweeps the nation as clearly we all get ready, just like we are for climate and other once in a lifetime change. So that said, have to acknowledge that even as the climate is getting older, the weather right now is tough from a budget perspective. And especially for many of us who've been around for a couple decades doing this, that always does make us nervous and anxious. So we are going to have to weather this together. And here's a couple thoughts. I won't get ahead of the governor, of course, the budget will be coming, but we will need to lean into our values and work with you all to do that, to protect people and protect our planet and protect everything that is wonderful about California and needs to be better. So thank you for helping us with that protection. And also knowing that despite the last 3 years where we had historic budgets, there are other ways to make progress. And the three that we're really driving on, one, of course, are bills, tons of policy opportunities in California, and not all of them have costs or have new costs. Two, implementation, all those things that were funded the last 3 years and beyond, we have implementation work to do. And three, we need our federal partners to lead as well. And truly in aging, California can go very far, but for example, we wouldn't have been able to expand Medi-Cal as we have in California without the Affordable Care Act. So that's the focuses, that's the strategies that we're looking at. And I just want to speak to a couple of examples that for each of those. So in care, one of the big ones that we can work on and need to work on is implementation of home and community services that are now available through Medi-Cal. I just looked at meals. We're now providing more home delivered meals in Medi-Cal, medically nutritious meals, than we are in our traditional meals program. How can we make that even more accessible? Who is that going to? How's the quality of the food? Let's really look at that. Another one that's been surprisingly, and meals is the number one community service, but we want to watch that and learn more about that. Maybe conversely, enhanced care management, which has the promise of being more like care management, even a multi-services MSSP type program, has really low pickup among older adults with their managed care plans. So we want to learn more about that. But those doors are open. And so how do we walk through them for the people who need it in all communities are really big implementation questions to grow care in that, at least that way. Where should I go next? There's so much we're working on. I'll say on aging well, two of the issues we're really concerned about right now. We hear so much about scamming in our personal life and our professional life. And we're really reaching out to AARP and others about what can be done with banks and trusted contacts. Bank of America is offering banks a trusted contact so that you can not have control of another person's money, but you can be alerted by the bank if there's a concern, whether it's to a loved one or to a stranger or it's some unusual activity. So we're exploring that. Is there legislation California can do to support the feds? Can we do it with our banking partners? What can we do there? Broadband. California is the biggest uptake of the subsidized broadband access, and the feds are thinking it's going to end. How can we get our federal partners, this should not be a partisan issue, to ensure that all of America has broadband access, and we know how important it is to older adults. I could talk about many other things. We are so excited by what we've accomplished so far. The $9.5 billion that the little Hoover acknowledged this spring. We're about to put out a report about all the Alzheimer's task force accomplishments. And so now, as we weather the budget storm, we need to keep our eye on the prize of how we continue to strengthen all of our aging programs, all of our aging partnerships, all of our aging policies, so that when that investment comes back, we are ready to go. So hope that's not too dispiriting. Hope that gives us some points of light of where to go. And so glad to be in this with you all together. With that, thanks so much.
Thank you, Kim, for joining us today and for all your efforts in the governor's office. We really appreciate your work there. And you heard what Kim said. It's important that all of us are showing up and advocating, sharing our stories all the time. And that's going to be critically important, especially in a tough budget year. So thanks for being here today. Thanks for being here every day to raise your voice and to advocate on these issues. Our next speaker, I'm really pleased to have with us today, Susan DeMorris is the director of the Department of Aging. Susan was appointed by Governor Newsom to serve as the director of the Department of Aging effective November 1st, 2021. Prior to that, Director DeMorris was with the Alzheimer's Association in California, where she led public policy and advocacy efforts. At the conclusion of the director's presentation, you'll have the opportunity to submit questions via the Q&A message box, which is located directly below the video. Once you've entered your question, be sure to click the blue send message box. So you'll have a chance to put some questions in there for Director DeMorris. So Director, welcome to the
Thank you, Kevin, and good morning to everyone. And thank you to the senior legislature for including me today in your program and for organizing your event. I don't know which annual event this is, but thank you for being here today on May 8th. It's so important to precede the governor's May revision and having a strong presence in Sacramento and remotely. So thank you for being here. And I'm just so happy to talk to you a bit about the Master Plan for Aging. We've prepared a few slides for you, and there they go. We're ushering in a new era. So here we are. We're in year 4 of California's Master Plan for Aging. We're almost at the midpoint, and boy, have we learned a lot since June of 2019, when the governor issued his executive order, and January of 2021, when the master plan was officially launched. It is hard to believe so much has happened since January of 2021. We'll go ahead and move to, as a refresher for everyone, I hope every person who's joining us today on the live stream can recite all 5 bold goals by heart. But in case you're not, we're sharing them on your screen. And we're so extremely proud that our state's Master Plan for Aging is very comprehensive. It includes housing, healthcare, inclusion and equity, as we heard from Kim McCoy-Wade, the care economy and the caregiving that works for both unpaid family members and friends, as well as the paid workforce. And then the big goal number 5, affording aging, whether it's utilities, rent, healthcare. So these are our 5 goals for all 10 years, our 10-year blueprint for the state. And we'll move for the next slide. You heard it referenced previously in very short order, the state, the whole of government approach, which includes the entire legislature, the governor, and the Newsom administration, our cabinet secretaries spanning Health and Human Services, Transportation, Housing, Natural Resources, have invested a combined $9.5 billion in programs and services and benefits that directly and indirectly support older adults, people with disabilities, and family caregivers. Next slide, please. You see here our third annual report to the legislature. This is an important accountability measure that we take very seriously. Every year we capture retroactively all of the accomplishments from the prior year. I hope everyone has seen our third annual MPA report. If you haven't, please access it on the CDA website and the MPA website for a recap of what we accomplished just last year. And then we're in closing in on the wrapping up the second series of 2-year initiatives. We're in the midst of the 2023-2024 MPA initiatives, and we're actively working on implementing, analyzing, and communicating 95 initiatives across all sectors. Next slide, please. I wanted to share a fantastic partner in our work this year. As those of you who know the Little Hoover Commission, they are an oversight entity, and at times they can be critical of the work of state government. And we were so heartened by their 2 days this summer, very deep, in-depth oversight of the Master Plan for Aging, Housing, and Homelessness for Older Adults. They were so incredibly thoughtful and attentive to our work, and wanted to share this quote for you to show that we have so many allies in this work in our whole of government, local government with our local area, our local aging and disability action planning grants at the local level, our statewide work, our partnership with the Little Hoover Commission and all of the cabinet agencies, as well as our federal partners at the Administration for Community Living, at the Centers for Medicare and Medicaid Services, our partners in the Veterans Administration and the Housing and Urban Development agencies. So we're just really encouraged by the attention that the Little Hoover Commission has put on the Master Plan for Aging, joining a chorus of other states and the U.S. Senate in propelling the master plan forward. Next slide, please. Kim McCoy-Wade referenced this, but finally, there has been legislation introduced in the U.S. Senate to propose a strategic plan for aging modeled on California's Master Plan for Aging. We couldn't be more proud to see this in action, and we're working closely with the U.S. Senate and our partners, our fellow partners that have master plans for aging already, master plans for aging and development, and those that are still contemplating it. Next slide. I wanted to remind everyone, first and foremost, in the coming weeks and months through the conclusion of the budget cycle and the legislative cycle, how important the senior legislature's advocacy is, your continued advocacy, as well as the coalition work. I know that joining today, we have a much broader audience than the senior legislature. We also have several standing committees, stakeholder committees, 6 in fact, that are ongoing, and many of you are represented on these stakeholder advisory committees. We replenish our ranks of these committees periodically, and so if anyone is interested in serving on these advisory committees, Alzheimer's disease and related disorders, our aging and disability research partnership with academic partners and researchers, our Disability and Aging Community Living Advisory Committee. This is the state's former Olmstead Advisory Committee, and we really focus here on home and community living, home and community-based services, housing and transportation. I'm just in awe of the work of the Elder and Disability Justice Coordinating Council. Just 2 years in, their focus on elder abuse and adult protective services, and really just very, very, very strong leadership on that. Our Equity and Aging and Disability Advisory Committee that preceded the master plan and continues to this day, and their efforts now to stand up a Lived Experience Advisory Committee. And then finally, as you heard from Kevin Prindeville, the Impact Stakeholder Committee and their work, their continuous work to follow follow the annual report and to provide us with critical feedback and direction continuously. So we're very grateful to all of our stakeholders, more than 100 who are officially named to these advisory committees. And last, these aren't the only groups. In our cross-agency and cross-department work, we serve on the California Interagency Council on Homelessness, and we also participate in the Behavioral Health Task Force, among other statewide committees. And then for our last slide, before we open it to questions, I wanted to be sure that everyone has on their calendar our next day of impact. This is how we ensure together that the Master Plan for Aging serves as a guiding light for all of our work, and that the report is not something that sits on a shelf. We have to be certain that together we update our initiatives every 2 years to keep the master plan alive, well, dynamic, and organic. And we do that formally on October 8th in Sacramento. You'll all be invited, and you're welcome to participate and join on that day where we set our priorities for system change in the coming 2 years. So I'll end there and take any questions that the group has. If you're not subscribing yet to our updates, please make sure that you subscribe so you don't miss a thing. And we'll be in close touch in the coming days and weeks around the budget, and encourage you to just keep advocating for all of the programs and services that benefit older adults, people with disabilities, and family caregivers. I'll close there and take any questions that the group has.
Thanks so much, Susan, for the presentation and for all of your incredible work. As a reminder, you all now have the opportunity to submit questions for the director via the Q&A message box, which is located directly below the video. Once you've entered your question, please click the blue send message box. And we've already got a couple questions coming in. The first, Susan, is what would you define as the #1 problem facing seniors in California?
This is an excellent question, and it's really our goal is to become more focused. And I would say affordability is absolutely the crisis that face most Californians. I see in the chat that, people, we talk often about 1 in 4 Californians will be age 60 or older by 2030. What we don't talk enough about is how many people are 75 plus. 85 plus is actually the fastest growing demographic in our state. And when people reach advanced age, they've outlived their savings and their assets, if they had them to start with. There's more medical complexity, more likelihood of having Alzheimer's or dementia. So absolutely, affordability, whether it's rent, utilities, food, that would be the biggest crisis facing older adults in our state.
Yeah, that's was our next question, was from somebody who was raising that very concern that as they grow older, they're fearful that they're going to outlive their resources. And they're wondering, what does the master plan speak to on this? And are there solutions that we can or should be advancing that could help address affordability for people as they age?
Well, I want to thank the senior legislature and other advocates that are on the call, because the governor and the legislature did approve $5 million to further explore long-term services and supports financing options for individuals in our state. We're now at the beginning stages of work. It took a while. This is one of the examples where we were organizing the work, we were framing the project, and we've now partnered in contract with some national leaders and experts around long-term services and support financing. We'll be sharing with you probably midsummer the work that's underway. And I can't tell you enough about the commitment of Secretary Galley, the Secretary of our Health and Human Services Agency, and the work across our departments, Department of Healthcare Services, Social Services, Rehabilitation, and Aging, to work together with our partners at the federal level, not to punt but there is a huge role for Medicare and Medicaid in accessing home and community-based services. So we're in active discussions with our federal partners at CMS, as well as our consultants that are helping us to define, what a benefit, an LTSS benefit could look like to reach the missing middle or the forgotten middle, people who don't yet qualify for Medi-Cal and are unable to pay out of pocket for the home and community living that they need.
Yeah, thank you. And I hope you have time for maybe one more question. And we're hearing from the Q&A people talking about, in particular, wanting to be able to stay at home. So I'm going to give you a chance here in a minute to talk about how those efforts you just described, if and how they're focused on helping people stay at home. And then a related issue, finding caregivers to stay at home and recognizing that we're in a care crisis, we're in a caregiver crisis, we're in a shortage of those workers that we all need to support us in our lives. So can you speak to how those efforts you were just talking about focused on LTSS are going to address, in particular, staying at home, and then also the worker crisis that we have, finding workers, treating those workers with respect? What can be done there?
I want to thank our advocates and stakeholders for their patience. I know with my own family, I wish our vision for the master plan could be realized today and all of these pieces could be in place. Two things I'll point to, Kevin. One is the home and community-based services gap analysis and roadmap. I know it's frustrating to watch more planning taking place when people are needed help in the home yesterday. And it's really hard to bridge that thoughtful planning with the need for real action. But I will say this comprehensive statewide 58 county analysis of what exists in the home and community-based services space and what, more importantly, doesn't exist and where the gaps are, and then how we close that gap. We know it's uneven across the state. I'll just take one example. Adult day health care or community-based adult services, half the state doesn't even have a single center. So we know that services and supports are inadequate today, and we need to grow that infrastructure statewide so that people have a real, true option to live at home and in the community. And then you talk about the workforce, whether it's home care with an individual IHSS worker or home care worker or home health worker coming into the home, or if it's in these congregate settings like adult daycare, adult day health care. The shortages are in the home and in the community. So growing our workforce of unlicensed and licensed workers. And I think we also have to be very creative. I'm excited about the HCBS gap analysis because when we look at 10.3 million Californians, we will not have a workforce to pair people one-on-one in their home. We need congregate settings and we need home care. And we need really strong transition services so that when people are hospitalized or institutionalized in a nursing home, they have a pathway back to their home and it's expeditious and they get the supports they need quickly so that they can return home. So all of that includes, a wide variety of workers of all types, not just doctors and nurses and social workers, but community health workers, home care workers, and IHSS workers.
Yeah, well, thank you, Director DeMorris. We know we have an ally in you and someone who really understands these issues and has lived these issues in your own experiences. So you're going to be hearing from us. You're going to be hearing from our whole community more and more.
I'm all ears. Bring it. I hope I hear from all of you.
Yeah. This is the issue that is facing families and communities across the state. And so we're going to be bringing ideas and demands and a strong voice asking for that opportunity to have affordable care at home with workers that we can find and support and be in community with to meet the needs of all of our families. So thank you for your work and your leadership, and thanks for staying on a few extra minutes with us today.
You bet. Have a great day. Have a great day. You'll hear from more. I think Adam and Sarah from CDA will join you later. So thank you. Thank you, Kevin, and thank you, CSL.
Yeah, thank you. All right, well, we're going to shift a little bit now, and we're going to get to hear from a number of legislative leaders from the California legislature. So the first I'd like to introduce is Assembly Member Cecilia Aguiar Curry. She's the Assembly Majority Leader, and in November 2016, she was elected to the California Assembly to represent the 14th District. So Assembly Member Aguiar Curry.
Hi everyone, happy Senior Rally Day. I just want to thank all of you for visiting us every year and your continuing advocacy for seniors. You know, as an older adult myself, I am well aware of the special needs of our aging population, and I will continue to fight for the issues that impact most of us. You know, it's no surprise that California is the largest population of older adults in the nation. However, we also have the largest population of individuals living with Alzheimer's. You know, a passion of mine, as many of you know, has been to prioritize Alzheimer's disease and address the need for memory care. This year, I introduced AB 2860 to expand the number of members who can serve on the Alzheimer's Disease and Related Disorders Advisory Committee, and to allow members with Alzheimer's to serve longer terms. This bill will ensure that these important stakeholders' voices are heard as the committee issues advice for addressing Alzheimer's across California. Another important issue for me was making sure seniors get appropriate care in nursing homes. Unfortunately, some facilities misuse drugs to chemically sedate dementia patients. While these drugs are meant for treating serious mental health issues, when used inappropriately, they increase the risk of death for our people with dementia. Last year, I authored AB 48 to make sure that nursing home residents and their families are informed about the risks of these drugs and get more informed decisions about their care. AB 48 is actually in the beginning stages of being implemented in nursing homes, and we are making sure that this process goes smoothly. So these are just a few of the things I'm working on, but as you all can see, the needs of the aging population are always on my mind. I want to thank you all once again for allowing me to send my welcome message to you all, and I look forward to continuing our work together. Thank you.
Thank you, Assembly Member, for that presentation. We're glad to have your support in our efforts. I next would like to introduce Assembly Member Jasmeet Bains, who's the chair of the Aging and Long-Term Care Committee in the Assembly. And Assembly Member Bains represents the 35th Assembly District. Assembly Member Bains, welcome to the 2024 Senior Rally.
Hi, I'm Dr. Jasmeet Bains, and I proudly represent Kern County in the California State Legislature. I also have the privilege of chairing the Assembly Committee on Aging and Long-Term Care. I'm honored to use the platform as a physician who understands the care older adults need and the issues affecting their daily lives. I'm sorry I can't join you for Senior Rally Day. I know you will all make the most of it to ensure the voices of aging and older adults are heard loud and clear. As lawmakers, we must remember that aging issues intersect with almost every other policy area. This year, we have a great policy portfolio passed through our committee, including several bills I have authored. I want to highlight AB 2541, which will require that peace officer standards and training work with experts to develop training to help assist people who have wandered. This bill affects more than just older adults who have Alzheimer's. Individuals with autism or other neurodivergent conditions are also prone to wandering. More than 60% of the people diagnosed with Alzheimer's disease will wander at some point. Nearly 50% of children with autism will engage in wandering behavior. These instances of wandering increase the chances of individuals needing assistance from or coming into contact with local law enforcement. Over 70% of counties in California do not have a rapid response program or registry to aid in finding a missing person with a cognitive impairment. Finding people when they are wandering is critical because the survival rate drops dramatically the longer it takes to find a missing person. This bill will give law enforcement more tools to help ensure the safe return of wandering individuals to families and caregivers. Bills like this one will help address the critical issues of creating a safer and more accommodating California for aging and older adults. I am thrilled to soon take up ACR 184 in the Assembly this week, which recognizes Older Californians Month. Let's celebrate the accomplishments of our incredible master plan for aging and all that we are working towards. Best wishes to all of you for Senior Rally Day 2024.
Thank you, Assembly Member. I would next, I'm really pleased to introduce Assembly Member Corey Jackson, who's the chair of the Assembly Budget Subcommittee number 2, Human Services. Assembly Member Jackson has also served as the chair of the Human Services Committee. The Assembly Member represents the 60th Assembly District. So welcome, Assembly Member Jackson, to the 2024 Senior Rally.
Good morning. This is Assembly Member Dr. Corey Jackson, and it is my honor to be here with you today. I stand with you for the cause that touches every community across California, and that is our sacred responsibility in supporting our seniors. We know you are remarkable individuals who have built our communities, and through the ups and downs of life, you have yet persisted and given us so much here in California. So now as you face the challenges of aging, it is our turn, our duty, to ensure you are not left behind. We must advocate for and strengthen programs that provide you and older adults with health care, housing, and the dignity and respect that you deserve. This is what I have been doing as chair of the Budget Subcommittee on Human Services, sending a message to all Californians that honoring your contributions means ensuring you are safe, making sure that you have what you need to continue to thrive. And so I'm here to say that I support you. I'm doing everything that I can to making sure that you have what you need. And most importantly, making sure that you have a safety net so that all you have to worry about is continuing to enjoy life and continuing to contribute to this great state of California. Thank you.
Thank you, Assemblymember Jackson, for being with us today. I next get to introduce Assemblymember Alex Lee, who is the chair of the Assembly Human Services Committee. The Assemblymember represents California's 24th Assembly District. So Assemblymember Lee, welcome to the 2024 Senior Rally Day.
Hi everyone, it's my honor to speak with you today and thank you, California's Senior Legislature, for inviting me to the Senior Rally. I'm Assemblymember Alex Lee, proudly representing the 24th Assembly District, including the counties of Santa Clara and Alameda. So if you live in Milpitas, Northern San Jose, Fremont, Newark, or Sonoma, I'm your Assembly member. As chair of the Human Services Committee, I'm committed to protecting funding for programs serving the growing population of older adults, whether that be caregiving, food benefits, or homelessness services. Housing should be a fundamental and universal right. But far too many older adults are struggling to afford a home. From 2017 to 2021, the number of Californians aged 55 and older who sought homelessness services increased 84%, more than any other age group. The housing crisis is tearing apart the social fabric of our communities. We need the public sector's intervention to help tackle this crisis. This year, I introduced AB 2881 to create social housing in California so that residents of all incomes, including our older folks, can have access to affordable, publicly owned homes. It's a model that's been successful nationally and internationally, like Singapore and Vienna. We need the public sector's intervention to help tackle the housing crisis through a public developer. We can build inclusive cities that are meant for everyone and allow older adults to age in place. Thank you so much for having me here. Thank you for incredible advocacy for so many folks across California, and it's an honor to be joining you virtually. Thanks.
Thank you, Assembly Member, for joining us virtually. We're really happy to have your support of our efforts. I next am pleased to introduce Senator Bill Dodd. Senator Dodd was elected in November of 2016 to represent California's 3rd Senate District. The senator is the chair of the Government and Organization Committee. So Senator Dodd, welcome to the 2024 Senior Rally.
Hello and welcome to the 2024 Senior Rally Day. For those of you who don't know me, I'm Senator Bill Dodd, and I proudly represent California's 3rd Senate District, and it's truly my honor and privilege to be here virtually with all of you today. First and foremost, I would like to thank the California Senior Legislature for inviting me to speak and for your tireless advocacy on behalf of seniors all across our great state. Even as a Napa County supervisor, I prioritized the needs of senior communities, and I am proud to be able to continue that work in my last year as California State Senator. Through the budget and legislative process, I am supporting the important work of the groups like the California Ombudsman Association, who are the eyes and ears for vulnerable seniors living in long-term care facilities across this great state. I also continue to prioritize bills that protect vulnerable seniors, including SB 278 that will clarify California's elder financial abuse laws. This bill holds individuals and entities accountable if they are aware of financial abuse against an elder and fail to take action to protect them. As many as you know, elder financial abuse is an epidemic, causing annual losses of $3 billion. SB 278 is a practical and important step forward, empowering victims of financial scams and to hold wrongdoers accountable. Lastly, I am working in collaboration with Assemblymember Calderon this year as a principal co-author of AB 2428. This bill aims to secure the future of community-based adult services, CBAS, a program that supports low-income seniors living with chronic conditions and disabilities age in place in the community. It is critical that services like CBAS are accessible to those who need it, both because it's the right thing to do and because investments in these programs often save the state money when the alternatives are institutional care. I once again want to thank all of you, particularly in the California Senior Legislature, for this opportunity to speak to you all today. Your ongoing dedication and advocacy is crucial to the legislative process. I appreciate each of you for taking the time to participate in this important work. Thank you all very, very much.
Thank you, Senator Dodd, and apologies to everybody that the video is freezing and that the audio is interrupted sometimes. We're working on that on the back end. But I want to, again, thank Senator Dodd for joining us virtually. Our next speaker is Senator Rubio, who is the chair of the Senate Insurance Committee and is the Assistant Majority Whip. Senator Susan Rubio represents the 22nd Senate District. Senator Rubio, welcome to the 2024 Senior Rally.
Hello, everyone. I'm State Senator Susan Rubio. I would like to thank the California Senior Legislature for inviting me to speak at this virtual Senior Day rally. This event is critically important to raise awareness about the issues that affect our seniors in California and their legislative priorities for this year. I'm always happy to explore policy with you, and I truly appreciate you bringing your expertise and lived experience. This is why I was very happy to have helped secure funding in the state budget to make sure that the California Senior Legislature always stays in place and that you always have a seat at the table and are advocates on such important issues that face our seniors in California. With a rapidly growing elderly population, we need to continue to support and provide for our older Californians. We must do this by ensuring their voices are heard real life applications can be achieved through meaningful legislation. Last year, I partnered with the California Department of Financial Protection and Innovation to provide free Scam Stoppers seminars aimed to educating our seniors about fraud relating to home repairs, insurance, finances, identity theft, and more. At the event, we learned about particular scams that are targeting our seniors. Criminals are using artificial intelligence to trick people into sending them money. They use AI to mimic the voice of your loved ones, making you believe that they're in real trouble. Unsuspecting victims then send money or share their private financial information. I want to leave you with some recommendations about dealing with these scams. If a family member calls you asking for money, saying that they're in trouble, in jail, or in an accident, hang up the phone and call them back at their regular phone number. Make sure you can confirm they are indeed in need. Please do not provide any of your personal or financial information over the phone. Please pass this information on to your friends and neighbors to try and keep all of us from scams and fraud. Once again, thank you so much for allowing me to address you today, and welcome seniors and advocates from across our state to this 2024 Virtual Senior Rally Day.
Thank you, Senator. And again, apologies that the audio is breaking up a bit there. We have one more message from a legislature. And so I'm excited to introduce next Senator Aisha Wahab, who's the chair of the Public Safety Committee. The senator represents the 10th Senate District. And so welcome, Senator Wahab.
Hi, folks. My name is Aisha Wahab. I'm a state senator for the East Bay and South Bay, basically from Hayward on down to San Jose. And I'm very happy to be here because I think it's incredibly important that we raise our voice to make sure that the needs that we have are heard and met. More specifically, I'm very proud of some of the work that I've done for specifically health and aging issues. This year, I have something called the SMILE Act, which is one of my favorite bills, and it's a passion project of my own. It's SB 980, which basically ensures implants are covered, dental implants, specifically for Medi-Cal recipients. I think it's incredibly hard. I hear it every single day that people are very, very concerned with the cost of implants. And the fact that Medi-Cal will pull out your teeth but not replace them is a problem for me and a problem for a lot of my residents. I'm sure that you guys have heard some of these concerns. So I really want to prioritize that as SB 980.
Hey, everybody. So apologies, but since that audio is breaking up, we're going to try to come back to that video later today. We're sorry about the audio problems, but we're going to stick with some live presenters that we have lined up now. So I'm really pleased next to introduce a colleague in the advocacy world, Maria Kalina. She's the Executive Director of the California Collaborative for Long-Term Services and Supports. Justice and Aging is a member, and we're really grateful for Maria's leadership of that important collaborative. She's also the Senior Rally's premier sponsor, or the collaborative is the Senior Rally's premier sponsor. So we're really thankful to the collaborative for sponsoring today's event. Maria previously served as the Senior Project Director for a Sacramento-based nonprofit that was dedicated to bipartisan and unbiased policy education. And finally, Maria served as the founding principal for Kalina Institute. So Maria, thanks for all of your work and welcome to the 2024 Senior Rally Day.
Thank you so much, Kevin. And let me just pull up my notes and I'll be ready to go. Hi, everybody. Hello again. I'm so excited to be here among such incredible advocates and have this opportunity to talk about the critical issues facing California's older adults and people with disabilities. We're just 6 years away from 2030 when 1 in 4 Californians will be 60 or older, and the demographic shift won't stop there. Behind the baby boomers are the millennials who will continue to drive California's 60-plus population to 32% in 2060. I'm not making that number up. That's from the Department of Finance. It's important to recognize that aging is part of the human experience, and it's something that we all do every day. It touches the lives of every Californian, all 40 million of us, whether we're older, whether we'll get older, whether we care for someone who's older, or whether we hope that someday our children will get to experience their golden years as proud Californians. And we're making tremendous progress in reshaping what it means to age in California with the Master Plan for Aging. So whether we're in a good budget year or a bad budget year, we simply can't afford to lose the momentum. It's going to take all of us working together in tandem with state leaders and continuing to elevate aging and disability as a priority to realize the vision of a California for all. In order to ensure dignity, independence, and quality of life in our later years, we must prioritize addressing the well-known challenges within our long-term services and supports delivery system. Many of the incredible programs and supports that exist today operate in silo, and the fragmentation across systems of care makes it difficult for older adults and people with disabilities, as well as their caregivers, to get the care they need when they need it. So we must continue to invest in and nurture our systems of care to ensure that these critical programs are able to scale to meet the growing demand. As we heard from Susan, more and more of our LTSS providers are struggling to keep the doors open. And again, as Susan mentioned, this is just an example. In less than a year between May 2022 and April 2023, 5 adult day centers have closed, resulting in 2 additional counties, Marin and San Joaquin, that now have no adult day centers at all. So not only is this a difficult reality for the older and disabled adults who relied on this program, but these closures are also impacting our family and friend caregivers who are no longer able to get the respite that they were getting from these centers. For Californians who reside in rural areas, accessing care is often even more difficult. Supports are either not available, not easy to get to, or simply not even known about. So we have older and disabled adults who are living in isolation, unable to meet their needs, or they're having to make that difficult decision of moving from their homes and beloved communities just to get care. Infrastructure, coordination, and capacity building are really just part of the picture. Again, as you've heard, LTSS is unaffordable for too many Californians. Half of our middle-income older adults wouldn't be able to pay for private assisted living even if they sold their homes. And this challenge is not going away. It will get worse unless we take action. Many millennials who, again, are aging right behind our baby boomers don't own homes to be able to sell, and they don't have as much in savings and retirement that they might be able to tap into. And if we don't prioritize LTSS now, we'll pay for it later through costly medical and emergency room visits, through premature institutionalization, increased poverty and homelessness rates among older and disabled adults who will have no other choice but to spend down to meet their needs. We must also recognize that a robust system of care is not possible to achieve without caregivers.
both those who have the heart for this work and do it professionally, and those who do it for their loved ones without any kind of compensation. Caregiving professionals who are predominantly women of color and immigrants receive low pay and meager benefits, and that underscores the broader issues of racial and gender inequity in our society. We don't value them, we don't support them enough, and as a result, California continues to face a critical statewide workforce shortage. Family and friend caregivers who contribute billions in economic value of unpaid care face the intricate challenge of juggling employment and childcare alongside caregiving responsibilities. And they often do that with limited support. Our caregivers give so much to California, and it's time that we make a commitment to creating policy that mirrors their contributions. So I'd like to just make one last point, and then I will turn it back to Kevin. I feel like the topic of housing and homelessness is on the news almost on a daily basis. We hear about it in most all places and spaces. It's a huge issue, and there's really no disputing that we're living through a housing crisis. I also think it's important to recognize that older adults and people with disabilities are disproportionately impacted by that crisis. And yet these populations are often not top of mind in policy solutions. Housing, single family housing, multiple family housing, community-based housing is foundational for the effective delivery of LTSS. If we can provide our older and disabled adults with adequate shelter and wrap around the care and supports they need, we can reduce the strain on formal healthcare systems and public resources. Now, I don't want to end on a negative note. I think it's important that we recognize and talk about the challenges. It's equally important to celebrate the progress and to give thanks to the administration and legislative partners for their commitment and partnership in tackling these issues. The Master Plan for Aging has been driving a lot of the work that's taking place to really dive in, digest, and meet these challenges with comprehensive policy solutions. We've heard from so many tremendous leaders today about the work they're doing. I don't want to really repeat what we've already heard. And we've heard about what they will continue to do to move California forward. On behalf of the California Collaborative's membership, I just want to say that we stand ready to partner, support, and work alongside you to bring the vision of a California for all to life. We know this is a difficult budget year, but we just can't afford to lose ground. Aging won't wait. So thank you for letting me ramble for a bit. I hope you enjoy the rest of today's session, as well as this afternoon's advocacy program. And I hope that you leave inspired to continue this important work. And with that, I will pass it back to Kevin.
Thank you so much, Maria. I love that aging won't wait. I think that's right. And we can't wait either. We got to be asking for what we need and demanding that from our elected officials and policymakers. So thank you, Maria, for those powerful comments, and to the Collaborative for the sponsorship of today's rally. We're next going to shift gears to talking about moving the master plan for aging forward in a tight budget climate. And our first speaker here is going to be, again, a leader from the California Department of Aging. I'm really pleased to introduce Sarah Steenhausen. Sarah is the Deputy Director for Policy, Research, and Equity for the California Department of Aging. She previously served as the Director for Policy and Advocacy for the SCAN Foundation. So Sarah, welcome to the 2024 Senior Rally Day.
Thank you so much, Kevin. It's such an honor to be here with all of you. And I just want to thank you all for your continued advocacy and in helping lead the way to prepare California for the aging of its population. So if we want to pull up the slides, I'm looking forward to talking to you a bit about thinking about how we advance the master plan for aging and keep the momentum going despite being in a very tight fiscal climate. Next slide, please. So really, I want to just focus for a moment on the fact that the master plan is a living document. This is something that we update every 2 years. And if you want to go to the next slide, right now, if we go to the next slide, please, we are in the middle of our 2024 MPA year. The initiatives for 2023, 2024 were very much informed by our stakeholders. Many of you might have been at the Day of Action a few years ago, and it was through the Day of Action that we heard from our stakeholders about the key priorities that they envisioned as part of the next iteration of the MPA. So we used that input to develop the initiatives that are currently in the 23-24 Master Plan for Aging and spanning across all of the 5 bold goals. So our goals will remain unchanged. Housing for all ages and stages, including age and disability friendly communities and transportation. Reimagining our healthcare system to be more whole person focused, spanning across healthcare and long-term care in a seamless way so that people can access the services they need when they need it. Goal 3, really focusing on changing the paradigm of aging and disability, fighting ableism, fighting ageism, focusing on inclusion and inequity, not isolation. Goal 4, addressing the needs of our critical caregiving workforce. This includes both our paid direct care workers as well as our unpaid family caregivers that provide the bulk of services and supports to all of the older adults and people with disabilities at home and in the community. And finally, goal 5, how can we ensure that aging in California is not synonymous with poverty? We need to make sure that all older adults have the resources needed to age with dignity and independence. Next slide, please. I wanted to focus for a few minutes on the fact that the MPA is a living document, not only at the state level in a kind of a whole of government approach, but also through our local partnerships. Many of you on this call are playing a key role in advancing the local master plan for aging initiatives. If you want to go to the next slide, I'm really pleased that we have LADAP is our local aging and disability action planning grant program that has been launched here out of the Department of Aging. We were fortunate to receive $4.5 million of resources in the 2022-23 budget, which then led to our releasing a request for proposals in a grant program to award many of our local cities and county partners resources to plan for their own local aging and disability population needs. So really proud of our partnerships with the local level and looking forward to seeing the continued great work that comes out of our local grantees. Next slide, please. So I wanted to talk a few minutes about the fact that, we really are proud of the results that we've seen since the beginning of 2021 when the MPA was launched. Next slide. Since that time, we have over $9.5 billion in investments that support older adults, people with disabilities, and caregivers at home and in the community and across the 5 bold goals. Now, all this being said, we know that we still have a lot more work to do. So we're very proud of our progress, and we recognize that a lot of work is ahead of us and that we can't pause and we can't put the pedal off the metal at this point. There should be a link available to the resources across the 5 bold goals that have been invested to date. So we have that on our website if it's not already been disseminated through this channel. Next slide, please. I wanted to take a moment to talk about really the key pillars of system change that we're focusing on as part of our system reform initiative. So it's important to recognize that the MPA is both trying to respond to the needs of older adults, people with disabilities, and caregivers of today, while also preparing for the long-term system change that takes several years to realize. And we do hope that by the year 2030, we are able to realize these key pillars and address the key system issues. Next slide, please. So I wanted to take a moment to talk through each of these 4 key areas of system change that we are advancing initiatives under. The first at the top of this square is navigation. And this gets to the issue of much of what Maria was talking about, how a lot of the times people don't know what services and supports are available at home and in the community, and they don't know how to access them. It is not easy for people. Most people aren't familiar with what our aging network is or where the programs and services are, or even what they might need. Certain local level partners have done a tremendous job at helping develop resources to help people streamline access to services and information, but we really need a statewide solution. So we are very pleased to be embarking on this No Wrong Door system change initiative, where right now we've stood up a state leadership council that's exploring what it might take to establish a whole of government approach to developing a system where we have a consumer facing statewide web portal that provides standardized information and resources to help people make informed decision about their needs for long-term services and supports, as well as a statewide contact center that can provide live help to people or caregivers when they need it, help direct them to the local levels for a warm handoff to partners who can support them in their care journey. But even if we realize our goal of developing a system to be much more navigable, we know that we have a tremendous challenge in terms of the availability of home and community-based services across the state. So we are blessed in California to have many critical programs that provide home and community-based services to older adults, people with disabilities, and caregivers. This is across both our Medi-Cal delivery system as well as the non-Medi-Cal delivery system that is funded through general fund dollars, other federal funds, and other special funds. We know, though, that for many people, they can't access the service they need because there's not availability of it, whether due to long waiting lists or just simply people living in areas that don't have the services they need to stay at home and in the community. So we are very pleased to be working in partnership with all of our Health and Human Service Agency partner departments in an initiative, two-part initiative that's being led by both the Department of Healthcare Services and the Department of Aging, where we have launched a home and community-based services statewide gap analysis and roadmap initiative. Many of you have participated in these discussions where we are analyzing services across both Medi-Cal and non-Medi-Cal to understand where services are available, developing kind of a taxonomy of services and supports, and then looking at the population needs and the demographics to overlay it with where those services might be available. We are going to be releasing the gap analysis later this year, likely before the end of December. And then following the release of the gap analysis, we will be developing a two-part roadmap. The Department of Healthcare Services will be responsible for the Medi-Cal Long-Term Services and Supports HCBS roadmap. And the Department of Aging, in partnership with our other state department colleagues, will be developing a roadmap to build out infrastructure for the non-Medi-Cal home and community-based services system. So together, between navigation and access, those are two big components to system change. But even if we have a more streamlined system and we build out access to the services that people need, we know that we have a significant workforce crisis, both in the paid direct care workforce, where we are going to need upwards of 3 million new direct care workers to care for the aging of our population. That's rapidly diversifying. We need to ensure a culturally competent workforce. We really need to build the pipeline and have the incentives so that people want to work in these settings, so that they see the value and that they feel the value in the work they do. Similarly, we need to ensure that our really critical 5 million unpaid family caregivers can be supported in the ways that they need to care for their loved ones at the home and in the community. So we have a number of initiatives underway right now to focus on building out a system for our unpaid family caregivers, including Department of Aging is launching a caregiver equity roadmap to really envision and look at closely what might be needed to better bolster and support our family caregivers in the home and in the community. And then finally, and not last, we need to think about system financing, because even if we've addressed all of these other components of navigation and access and workforce, we know that we're facing a crisis as a state in terms of how people plan for and finance their own long-term care needs. We're really pleased that the state has eliminated the Medi-Cal asset test so that people can qualify for Medi-Cal and get their long-term care needs covered just through their income qualifications. But we know that much more is needed. There are many people who fall above the Medi-Cal income level in what's called the missing middle or the forgotten middle, who end up impoverishing themselves to pay for their long-term care needs. And it also puts a tremendous pressure on families who end up supporting and paying for the services that their loved ones need in the home and in the community. We know that we have to do better. We know that this system, this issue of financing is something that we must be paying significant attention to. And we also know it's not something that our general fund dollars can really provide the whole solution to. So we need to think about what are the range of policy options across the system, whether it be Medicare and Medi-Cal, that we might look to as a comprehensive set of solutions to address this financing crisis. So we're really pleased to be working right now at the Department of Aging through our LTSS financing initiative, where we have identified some real leading partners to help us explore different policy options. And we're hoping that we might be able to advance a proposal with the Department of Healthcare Services to look at the role that Medicare could play in providing coverage of home and community-based services, maybe through a demonstration. This is all very early stages. So all four of these issues, four of these quadrants are encompassing a lot of the work that we're embarking on. And I will say, I want to underscore one thing, which is the role of housing. So what I didn't talk about in access issues, when we talk about access to services in the home and the community, this includes affordable, accessible housing. And the issue of older adult homelessness is a crisis. And we have to continue to explore what options are available so that people, as they age, are not priced out of their homes, priced out of their rental units. So we have to do better as a state, and really pleased to be working in partnership with the Business Consumer Services and Housing Agency at looking at this issue. So this is kind of an overview of what we're approaching right now and how we're trying to plan for the future. Next slide, please. I want to just underscore the importance of the MPA stakeholders. The master plan for aging is really only meaningful if we have strong stakeholder engagement. Next slide, please. We're really pleased that we have these 6 critical advisory committees: the Impact Advisory Committee, which is kind of the MPA oversight body, as well as the Aging and Disability Research Partnership, which is a partnership across university, academia, and the state and philanthropy to look at the research needs of our population. The third, the Equity Advisory Committee on Aging and Disability, plays a very important role of uplifting the issues that are important from an equity angle to ensure that we are embedding equity across all 5 bold goals. Fourth, the Disability and Aging Community Living Advisory Committee plays a critical role in helping identify those issues across home and community-based services, housing, and transportation that need to be elevated as part of the Master Plan for Aging. Fifth, the Elder and Disability Justice Coordinating Council plays a very pivotal role in identifying the issues impacting older adults and people with disabilities that need to be addressed to ensure that people can age with dignity and in environments that are free from abuse and neglect. And then finally, our Alzheimer's Disease and Related Disorders Advisory Committee has a very important role to play in uplifting the system-wide issues impacting people and families who are afflicted by Alzheimer's disease. So all of these committees are working committees, and they provide real-time input to the state for our consideration as we advance the Master Plan for Aging. Next slide, please. I wanted to call attention to something we're really excited to be partnering with our foundation partners. Without their support, we would not be able to bring together all of our stakeholders at the end of every 2 years. This year, it's going to be October 8th at the Safe Credit Union Convention Center here in Sacramento. We will be releasing the save the date soon, so please be on the lookout for that. And if you want, just put a bookmark in the website www.calforall.org, which is where all the information will be. The reason that this event is so critical is that this is the place that each of our advisory committees is able to elevate their top 3 critical priorities that need to be considered in the next iteration of the master plan. So as I noted at the beginning of this presentation, we are in the middle of the second year of our 2023-24 Master Plan for Aging initiatives. After the day of action this year, we will be working internally with our state partners to take all the recommendations that we heard from our critical stakeholder partners and considering what we might build out for the next iteration of the Master Plan for Aging that will span the years 2025-2026. So your voice really will matter. We're looking forward to this event as a time to bring together state partners, stakeholders, as well as consumers to really focus on the needs of the person in advancing a home care system for all, including housing and the related services. Next slide, please. So I didn't want to leave today without recognizing the elephant in the room, which is we are talking about advancing the Master Plan for Aging. And right now we are foreseeing a very difficult fiscal environment. And I want to underscore the importance of taking the time to think about where the opportunity might be in these difficult times. And as Albert Einstein said so eloquently, in the middle of every difficulty lies opportunity. So next slide, please. I understand that anytime the state is facing potential budget reductions in issues and programs that support older adults, people with disabilities, and caregivers, that it's stakeholders' role and responsibility to really think carefully about how to advocate for the needs of that population and to not just sit back and watch it happen. And we really value the work of our stakeholders in advocating for the populations that you represent. I will say, though, that even in tight fiscal times, and I'd say especially in tight fiscal times, the Master Plan for Aging is critical. It doesn't mean that we are solely protected from every budget reduction because we as a state face a $70 billion deficit. There is no way that one department, one agency, one part of government can solve that fiscal crisis. So anticipating that, we might be seeing some really difficult, budget decisions coming down the path. I think that what I encourage all of you to do is to continue the work you've been doing and really focusing on these 4 Ps. One is people. So making the relationships, not just with each other, but making sure that you are developing the key relationships that are needed in the legislature, in the administration, with each other, so that you know how to navigate the tight fiscal times and who to reach to when. When of course, always keeping in mind the person through all of it. So why we're doing what we're doing is for the person. The second is the value of partnership. And I know that we see tremendous partnerships in a lot of the work that has been done through the Master Plan for Aging. And the partnerships that you develop are critical in advocating to the legislature and to the administration. The more that you can speak with a common voice and work across aging, work across disability with a common platform, especially in these challenging times when there's so many issues, so many critical needs across the whole population, the more that you can have strong partnerships and work together, the more effective you will be. Third issue is priorities. It's very easy to look at the whole picture and say that everything is a priority. But the more that you can zero in on 1, 2, or 3 top priorities, especially during these tight times, the easier it will be for the legislature and the administration to know what your biggest concerns and issues are, and then making it more likely that you might see traction in that space. And then finally, persistence. I think that it's understandable that when we're in tough fiscal times to want to just say, forget it. This Master Plan for Aging, how does it have any meaning if we're seeing challenges being brought to these programs and services? But we know that the Master Plan can endure through that. We saw through COVID how COVID helped inform the state's understanding of the issues impacting this population. We also saw that tremendous investments were made when the budget perspective did change, and that the stakeholders were persistent in elevating those issues even during the difficult fiscal times, so that the priorities were ready to go, and that when there was a window of opportunity, there was able to be system advancement. So these kind of the people, the partnership, the priorities, and the persistence is what I hope you all can take away, and that just keep your faith and let's work together to continue advancing California for all ages and abilities by 2030. Thank you so much.
Well, thank you, Sarah, for being here today for that message. We certainly heard you, and I think really heard about both the continued work on the master plan for aging and also the need for our advocacy coming up here in a budget situation that it sounds like it's definitely going to have some things that we don't like in it. So we're going to need to work together, and that sets up perfectly our next panel. So we're going to move now to a panel discussion that's going to be focused on coordinated advocacy in a tight budget year. So to exactly the point that Sarah was finishing up on, at the conclusion of the panel discussion, you'll have an opportunity to submit questions via the Q&A message box that, again, is located directly below the video. Once you've entered your question, be sure to hit that blue send message box so that it gets sent to the people that are watching that box. I'm pleased now to introduce my colleague at Justice and Aging, Yasmin Peled, who's the Senior Policy Advocate at Justice and Aging. She really leads all of our California policy advocacy. And Yasmin's going to be moderating a panel, and Yasmin will be introducing the rest of our speakers today. So welcome, Yasmin. Thanks for being here.
Sorry, I am muted. Good morning, Senior Rally Day. It's great to be here with you today. And thank you, Kevin, for that introduction. We have a great panel lined up for you today to discuss advocacy in a tight budget climate. We're joined by Megan Burke, Program Officer at the SCAN Foundation, Monica Kirkland, State Policy Director at the Senior Services Coalition of Alameda County, Dan Okenfuss, Public Policy Manager at the California Foundation for Independent Living Centers, Dr. Kathleen Sullivan, Executive Director of Open House, Sawait Siyum, Senior Legislative Advocate at Disability Rights California, and again, I'm your moderator, Yasmin Peled, with a Senior Policy Advocate at Justice and Aging. Our panelists are going to discuss how the budget deficit could impact the services that older adults and people with disabilities rely on, and the organization's advocacy strategies in a tight budget year. We'll also be taking your questions, so again, please feel free to leave comments throughout this presentation and scroll down to that comment box, and we'll try to answer as many questions as possible before lunch. Before we turn to our panelists, I'd like to take a few minutes to reflect on the moment that we're in. As we've already discussed today, there have been many important investments and improvements in the last few years in the services that older adults and people with disabilities rely on. However, we still have work to do. 15% of California seniors live in poverty. And while poverty rates generally decreased during and after the pandemic, seniors were the only group where the poverty rate has actually increased. And to talk about the current state of senior poverty, we really have to look back at that last recession and the destructive cuts that were made. There were devastating cuts made to SSI SSP grants in 2009 and 2011. These cuts resulted in 1 million older adults and people with disabilities being plunged into poverty, all while additional social service programs were also being cut, including Adult Day Health, MSSP, IHSS, and Medi-Cal, further hurting and setting back our communities. In the last 13 years, as the state has recovered from those major cuts, most of the programs have been restored. However, we still live with the impact of those cuts. In the tight budget situation we find ourselves in this year, it's important to remember the decisions made in 2009 and 2011 and do all we can in our advocacy to ensure the same decisions are not repeated. Despite this budget situation, we have the 10-year roadmap of the MPA, which is supposed to lead us in good times and in bad. and we appreciate the ongoing commitment from the legislature, the administration, and the advocacy community to implement the plan. But we must hold firm that cuts to core programs that serve older adults and people with disabilities is a direct affront to the goals of the MPA and the progress that's been made thus far. Our communal advocacy needs to be focused on maintaining the investments that have already been made and laying the groundwork for future investments once the budget improves. We certainly recognize that the budget deficit of this year and potentially future years are a major challenge. However, we're up against the clock. The demographics of the state are rapidly changing, and we need to aggressively invest in the systems that will support older and disabled adults. And we must ensure that these future investments are ongoing and sustainable for the state in the long term. As we enter the hardest part of the budget cycle, I know we will all remain steadfast in our commitment to older adults and people with disabilities, and we're stronger when we all advocate together. Thank you for being here today. So now let's hear from our panelists. First up is Megan Burke. Megan is the program officer of the SCAN Foundation. Megan leads the foundation's California public policy strategy and grant making to advance state solutions that improve the lives of older adults and people with complex care needs and their family caregivers. Megan has extensive experience in researching and developing policy solutions, communications, and coalition building, as well as direct service in aging, family caregiving, health, and long-term supports and services. Megan, take it away.
Thank you, Yasmin, for that introduction. And thank you to the California Senior Legislature for bringing us all here today. At the SCAN Foundation, we envision a society in which all of us can age well with purpose. And as such, we seek to ensure that the systems supporting the health and well-being of older adults are affordable, accessible, and reflective of their diverse needs and preferences. I'm thrilled to be here with my esteemed colleagues on this panel as we talk about advocacy opportunities during this tight budget year. As many have said already today, we must ensure that the infrastructure serving older adults and people with disabilities not only remains intact, but is strengthened and improved upon so we can all age well. Again, there's been a lot of talk today about California's master plan for aging and how it is this guide for us during not just the good budget times, but the bad. And to date, you know, the collective effort of stakeholders, policymakers, philanthropy, and others to develop and implement California's master plan for aging has had real impact on people's lives. And yes, there is still a ton of work to be done. A lack of comprehensive home care coverage, limited incomes, caregiver workforce crisis, and unaffordable housing present compounding barriers to aging and homing communities. And while the SCAN Foundation believes working to address disparities and improve access to care for older adults of color, those with low incomes, and those living in rural or underserved communities will have positive impacts for all, we'd be remiss if we did not acknowledge the challenges in accessing home care and affordable housing faced by middle-income older adults who aren't eligible for Medi-Cal and can't afford to pay for services out of pocket. As you've heard today, often referred to as the forgotten middle, these individuals face incredible barriers to accessing home care, which can negatively impact their health and well-being. As part of a caregiving network for a close family friend, I've seen the challenges of navigating our fragmented service system and the difficulties of affording care. My friend spent most of her savings paying for home care, medications, equipment, and supplies. Her children have contributed financially where they can, but it's impacted their ability to address their current needs as well as save for the future. And affording her care was reaching a critical point. But key changes to Medi-Cal eligibility over the last several years, such as raising the income eligibility limit and eliminating the asset test, actually made it possible for her to finally access in-home supportive services. And it is truly this support at home that has very literally prevented institutionalization and unnecessary hospitalizations, allowing her to remain with her husband and her cute little dog in her home, participating in the activities that are meaningful to her. This is one story among many, and I'm willing to bet we all know of someone who has faced these challenges or faced them ourselves. By 2033, 89% of middle-income Californians aged 75 and older will not have enough financial resources to pay privately for care. And while the middle-income older adult population is and will continue to grow more diverse. Data shows the widening gaps among Black and Hispanic middle-income older adults around home ownership, home equity, and financial assets compared to their white peers, so adversely impacting the ability to afford care. A smaller subset of the forgotten middle, lower income individuals with Medicare who are just above that eligibility limit for Medi-Cal have higher rates of chronic conditions and disability compared to their counterparts with higher incomes. They also have less access to family caregiver support. And older adults of color are disproportionately represented in this near Medi-Cal eligible population. Without solutions to make care more affordable, we continue to further disparities in care. We also, as we've talked today, must recognize that safe, affordable housing is critical for accessing home care, but many older Californians struggle to afford their housing. A recent report shows that older renters are particularly vulnerable, especially those that are the 63% of extremely low-income renters who spend more than half of their income on rent and are more likely to be older adults of color. That's why we must forge ahead to create quality, equitable, and accessible home care system for all, while also working to prevent and end older adult homelessness by making housing more affordable. Focusing efforts on 2 specific areas within the Master Plan for Aging, we can work with the state to create the lasting change that's needed. A couple of areas of opportunity during these tough budget times, areas to prioritize, recently elevated by the Master Plan for Aging Impact Committee, include working with the state to develop a strategy for identifying those revenue sources for a statewide home care benefit for all Californians. Prioritizing older adults and people with disabilities in the development of affordable and accessible and stable housing. And creating a plan for investments that expand successful programs like rental subsidies to prevent homelessness, just to name a few. The SCAN Foundation is committed to working with our partners through the California Collaborative for Long-Term Services and Supports, as well as the numerous Master Plan for Aging stakeholder committees, to educate policymakers on these key issues and develop solutions that advance equity in aging. We're also supporting the work of older adults and advocates in local communities to bring forth solutions based on their lived experiences through regional coalitions in multiple counties throughout the state, and 4 new equity community organizing groups located in Imperial County, Los Angeles, San Francisco, and Sonoma County that will bring together aging and social justice groups to help address the health inequities older adults are facing in their community. So while we might be entering a tough budget time as a state, we must continue to raise our voices, share our stories, and work closely with policymakers to help address, to help advance critical transformation that will ensure all Californians have opportunity to age well. So thank you, Yasmin, and I look forward to hearing from the rest of our panelists.
Thank you, Megan. Next up, please welcome Monica Kirkland. Monica is State Policy Director at the Senior Services Coalition of Alameda County. Monica brings over 15 years of active involvement in the Northern California community. Her diverse background in leadership development, community engagement, government relations, and ministry has equipped her with the skills to embark upon new opportunities, such as assuming leadership roles in various nonprofit organizations, board membership, as well as sponsoring a local nonprofit. Monica, thank you.
Thank you, Yasmin. I appreciate that. And thank you to all who put together this amazing Senior Rally Day and to my esteemed panel colleagues. I'm glad to be here. Senior Services Coalition, just to share, we represent over 40 organizations that provide health and supportive services to over 89,000 low-income older adults in Alameda County. And we are committed to advancing public policy that improves health and life outcomes for older adults. So when it comes to advocacy, the way our coalition sees this budget year is that delayed funding and funding cuts will gravely disrupt the ecosystem of support to older adults and those with disabilities. When the community-based organizations don't have adequate funds, it becomes difficult because when providers have to turn people away, or they might even have to put them on wait lists. So they're forced to serve only those who are acute, those with the highest needs, which means they can't be preventative. And that in itself is an issue. So it takes a village of support. We think of aging services as an ecosystem. If any one of those parts gets disrupted by funding cuts, then the whole system suffers. So for instance, let's take Miss Betty. Let's say she has vision problems, diabetes, and she lives alone. Well, when we consider the social supports that are necessary, because she may have vision problems, she's going to need transportation. That is a community-based support. She may need grocery shopping, right, to run errands. So that's a personal area. When it comes to social, maybe a friendly visitor or a caregiver support, depending on how difficult her needs are. And then when it comes to medical, because she has diabetes, medically tailored meals or a case manager if situations get worse, because it's difficult for her to navigate the many different systems. So if the program that provides any of these supports is cut, it destabilizes Mrs. Betty's support system and it puts her at risk. And there's many more Miss Bettys out there. And so these programs exist because people need them and they are effective. Because of the reality of people needing these services, our organization is advocating for these services. We need more funding, but at minimum, we don't want it cut. So this year we are pivoting to protecting existing funding. So our message is that we cannot afford to cut programs that are already not adequately funded. And at the same time, there are real growing needs for supportive services in the community, and the need to increase capacity is extremely pressing. We can't stop advocating for funding and services because maybe a legislator may be uncomfortable due to the budget year. We understand that. So while fighting to protect programs and funding, we continue to advocate and educate, even with our legislators, on the importance of increasing capacity, the importance of focusing on a prevention, because if we don't invest in one end, we will end up paying for it in another area. So in short for that would be prevention. Going upstream, it's crucial for breaking the cycle and reducing costs from the front end. And an example of this is how we are focusing on housing insecurity this year, which is a pressing issue. I know many have spoken about that already, and I think a lot of us are on accord in that respect, that we are working to protect the Home Safe program, and we are and the Home Housing and Disability Advocacy Program, also called HDAP. And we're also advocating for SB 37, which includes a budget request for new funding. When we look at Home Safe and HDAP, it must be protected. They're the only two programs that focus on housing and homelessness prevention, specifically for older adults and adults with disabilities. So for instance, Home Safe, it prevents it's there to prevent or to address homelessness, to support the safety and housing stability of individuals involved in the adult protective services. HDAP, which I mentioned, it assists, again, people experiencing or at risk of homelessness who are likely eligible for disability benefits as well as housing support. So the problem here is that when funding is delayed or cut, it halts the operations of a program and services. So we look at a fiscal delay, but on the other end, it's an operational halt. The program stops, right? So it's a delay fiscally, but the program doesn't continue. And so another one is SB 37, which could create a rental assistance pilot program for older adults, which I know you'll hear about that later on this afternoon. And it's for adults with disabilities also who are homeless or at risk of homelessness. And we know, again, this is a $25 million request. It's difficult to win in this tough budget year, but the need is pressing and we want to pursue it. So those are just some of the areas that we're focusing on and what that looks like this year. But advocacy is it's not something that is restricted, right, to just those of us who are operating in policy or at the Capitol. It's really important that the legislators hear from each individual within their communities, hear your amazing stories, what's happening, why it's impacting you. So I do encourage those who have not been advocating just to speak to your legislators about these pressing needs as well that are impacting you. Thank you.
Thank you, Monica. Next, I'm pleased to introduce Dan Okenfuss, Public Policy Manager at the California Foundation for Independent Living Centers. Dan's role is to ensure CFILC's voice is heard in the halls of the state capitol. Dan has had a long career in public service and has worked for many distinguished legislators, including current Assemblymember Tim Grayson and former Assembly members Susan Bonilla, Jared Huffman, Ted Lieu, and Dario Frommer. Dan has also worked for former State Insurance Commissioner Dave Jones and served on the department's Disability Advisory Council. Dan?
Good morning, everyone. My name is Dan Okenfuss, and I am with CFILC, the California Foundation for Independent Living Centers. Happy to be here today and to tell you a little more about CFILC and our budget outlook for this year. CFILC's mission is to increase access and equal opportunities for people with disabilities by building the capacity of independent living centers. In California, we have 25 member ILCs, as we're known, across the state in the urban areas and rural areas across the state. And we provide services and supports for people with disabilities so they can live comfortably in their own homes. We serve over 26,000 individuals with disabilities at our ILCs, providing over 100,000 different services and connections and over 53,000 hours of community service. At CFILC, we are part of a partnership with the Department of Aging in a program called the Aging and Disability Resource Connections, or ADRCs. And these are partnerships between our local ILCs and also the county area agencies on aging and other partners who work with people with disabilities and seniors. And the idea for this connection, which is kind of been created as a part of the Master Plan on Aging, is for key service providers in the community to come together, break down barriers, and advocate for expanded services across the lifespan of our consumers. The ADRC, as I mentioned, is the partnership, and we work together to provide support to older adults and individual disabilities to live their lives independently and prevent the risk of institutionalization. The partnership includes these 4 core services of ADRCs. We provide enhanced information referrals. We also provide options counseling, options for daily living, short-term service coordination. That could be anything from housing to employment to public transportation and other connections, and also connection to caregivers. And also we work with our consumers on transitions from any community care facilities back into their own homes. One of the things we like to promise about our ADRCs is that we're there for all age, people with disabilities of all ages. And we are committed to expanding these services to our consumers. And for example, when they come to our ADRC, they usually are looking for answers. So they come asking, I don't know how to get my healthcare benefits. I can't find in-home care. I can't find affordable housing or access to reduced or free food. And I also mentioned public transportation or home modifications and other things I need to live. I know there are resources out there, but I don't know where to start, what I'm eligible for, or how to apply. And I can't find anyone to help me. So what these consumers are looking for is what we call long-term services and supports. These are all the programs, benefits, and resources that enable those of us who are aging or have disabilities to live independently. And we know how hard it is to find and access those services you need. So through the ADRC program, we have staff that are available to make those connections to the service and supports that our consumers need. And this is done on a very, very tight budget. It's done with a line item in the budget that we call budget dust, which is barely enough for the merging and designated ADRCs to provide the core services. With a little bit of extra funding, they could even expand to other communities and have more capacity to reach out to more consumers in need. So during these tight times here, and we're awaiting the results of the May revised budget, we are aware that there could be some cuts in our programs here, and we hope ADRCs are still left intact. And there's a reason why, because any cut means less connection to our consumers, and also it strengthens our need to provide stronger advocacy for these ADRCs. So lately, CFILC has created an advocacy alert program where we can have consumers fill out their name, their address, and we have a automatic way for them to communicate with their legislators as to the need to save their funding for these programs. So I don't want to get into too much more detail here, but we're happy to answer any questions at the end of our presentation. But we are proud to be here for the Senior Legislature Advocacy Day and the Rally Day, and have a great rest of your program. Thank you so much for letting me be here.
Thank you, Dan. And just as a reminder to folks, we'll be taking questions at the conclusion of the panel. So please put your questions in the comment box. Just so scroll down below the video and you should be able to put in your questions. Up next, we have Dr. Kathleen Sullivan, Executive Director of Open House, a nonprofit supporting LGBTQ older adults in San Francisco with a suite of services, including affordable housing, mental health supports, enrichment programming, and social services. Dr. Sullivan had a career in working in politics with communities to defeat anti-LGBTQ ballot measures and policies before she returned to graduate school to study how supportive social environments positively impact LGBTQ older adults and produce a sense of belonging and social connection. Everyone, please welcome Kathleen. Kathleen, we can't hear you. Can we hear?
How about now?
That's great.
That's great. Okay. I'm on a different computer for my sound. I just was saying thank you so much for the opportunity to be here. I think that a lot of us are experiencing similar things and have some similar things to say. Open House is an organization, as Yasmin said, in San Francisco, and we enable LGBTQ older adults to really navigate their lives and the barriers that they face so that they can thrive in older age. In these tight budget times, as we all know, it's very easy to simply cut programs or services or what I would call lifelines for older adults. And we've seen this before, and certainly I understand the state must make choices to meet the budget demands that it currently has. In our current budget iteration in this cycle, I would, on behalf of Open House and the community of LGBTQIA older adults who we serve, ask the CDA, the state legislative leaders, and the governor to consider the vital importance of the Master Plan on Aging and the work that has started and the success it's made in the lives of many. To be clear, there are many older adults who remain in dire situations. Someone referenced earlier the increase in homelessness amongst older adults. So whether it's homelessness or food insecurity, barriers to care and services for LGBTQI older adults, we in the field of aging services have much to do. And I'm also really heartened by the fact that we work together and we will continue to work together to prioritize how we can in this budget cycle really look towards those items that will greatest impact or most positively impact our community members. If we were asked by the state to prioritize those areas for the state to maintain or expand funding in, even in these difficult times, they would include programs that either combat homelessness, maintain housing, or support people staying in their homes. So first, of course, and I believe others have mentioned it, to continue to work at combating homelessness of older adults in the state to fully fund the Home Safe program. We know that once an older adult is homeless, it's certainly much more difficult for them to get into stable housing, which leads to the second point, a targeted rental subsidy program. We've seen some success here in the state of California and in other places across the country. We ultimately, as a state, will save money in the long run if we keep and help older adults maintain their housing. Housing, as many of us have heard, is a pillar of healthcare, particularly for older adults who can suffer so greatly living on the streets. And finally, the state has focused through the CDA and the Master Plan on Aging at creating solutions to the high cost of in-home care and support services. In-home care, whether it is to support ADL or IADL functionality, that's activities of daily living or instrumental activities of daily living of older adults, is essential for people to remain in their home as opposed to being institutionalized. Again, it's an upfront investment, but one I believe we need to make because that investment will actually save us money in the long term, but also allow people to live with dignity, respect, and with self-efficacy. Again, we save money as the state when we invest in housing for older adults, keeping people housed or helping them get into housing. A key component is providing the care needed in their home. And despite these difficult times, Open House would like to see the governor and legislature continue to invest in these vital lifelines for older adults. It isn't all that is needed, certainly. There's great food insecurity. I was recently on a panel with the leader of the Los Angeles LGBT Center's Senior Services Department, and she talked about the high level of food insecurity for Los Angelinos in their service area. Mental health support is also clearly a vital need for older Californians. But we are better able to serve those in need if people are simply housed first in stable homes. I support what my colleagues on the panel have said, particularly in working together, because if we don't work together, we're not going to be able to actually achieve the goal of ensuring that everyone can have a golden senior life here in California, whether that's for people my age, older, or for those who are coming behind me. So I'm really appreciative of the panel today and of the rally. I would just encourage again the state to really look at the investment in housing for older adults, maintaining or helping people get off the street as one of the vital links to older adults' healthcare, and that in and of itself will help us to reduce long-term costs. So I'm going to pass it back to you, Yasmin. Thank you.
Thank you so much, Kathleen. And finally, we have Sawait Siyum, Senior Legislative Advocate at Disability Rights California. Sawait advocates on issues related to healthcare, long-term services and supports, home and community-based services, including IHSS and other human services-related issues. She previously represented IHSS providers at AFSCME UDW and SCIU ULTCW, and has worked for legislators in various capacities over the last 20 years. Sawait?
Thank you, Yasmin. Good morning, everyone. It's such a pleasure to be with you all this morning. Really have enjoyed the whole program. My name is Sawait Siyum, and I am one of our senior policy advocates for Disability Rights California. And as Yasmin shared, I cover primarily health related issues, long-term services and supports, and home and community-based services and care. You know, we at DRC, as has been expressed by everyone really, have been challenged by the dismal fiscal environment that we find ourselves in. And before I sort of delve into that and how we have I think looked at our strategy for advocacy this year, I want to share, for those who may not be familiar with our organization, Disability Rights California. We were actually founded in 1978, and we are the largest protection and advocacy organization in California. We are the only patient and protection advocacy organization in California to advocate on the rights of Californians with disabilities. There is an organization in each state as required by federal law. And so we litigate, we work on legislation, we investigate, we provide education, and so on and so forth. And we have offices all throughout California with attorneys, advocates, folks who work one-on-one with individuals throughout the state, and approximately about 300 or so employees throughout the state of California. And as I was sharing, our organization has also been challenged by the dismal fiscal climate that we find ourselves in. And we really have had to pull back in terms of, what we wanted to go after this year, right? I think what we did is we took the approach of less is more and focused our efforts. One of our top priorities for this year has been the home and community-based waiver. This is a waiver, a Medi-Cal program that provides home and community-based care and services for people who need skilled nursing care to live at home. We in July of 2023, DHCS paused enrollment in this program. And since, as of March of 2023 or 2024, there are approximately close to 5,000 individuals on the waiting list. And we are advocating for this waiting list really to be eliminated. The governor proposed in his January budget to increase slots, but it simply is not sufficient. The proposal isn't sufficient to meet the demand. And so the home and community-based waiver expansion is essential to advance community integration, to allow individuals to live at home and in the community. And also it's an issue of equity. We find that there's a disproportionate number of adults, those aging and persons with disabilities who are of color, and also just inequities in terms of other affiliations. And so we really have been advocating in the legislature, advocating directly with the governor's office or administration to clear the waiting list. And part of our strategy has been to work with our federal partners. Congresswoman Nanette Berrigan has worked really closely with us to advocate for the expansion of the HCBA waiver program. She was responsible for leading an effort to put together a letter of support where I think it was over 21 members of Congress who signed on to support this effort. We've also been working on a media strategy. Earlier this year, there was an LA Times article that highlighted this issue. And I want to also just note that the HCBA waiver program is particularly essential for medically fragile children as their only pathway to receive services and care. In fact, some of our advocacy included working closely with a family in the Bay Area who found themselves in a situation where they were unable to access care for their child. But I'm pleased to share that we were successful in advocating for this family, and they were able to get the care that they needed. And we just want to make sure that others throughout California who are on this waiting list, who need these programs in order to live safe at home in the community, are able to do so. So that has been our top priority this year, and we are hopeful that the May revise will reflect a solution to the end that we've been seeking as part of our advocacy this year. Thank you. Yasmin, I'll turn it over to you.
Thank you so much. So we just have a few minutes left, and so I want to ask our panelists to answer this one question, and if everyone can provide an answer and maybe keep it brief so we can send folks off to lunch on time. But I'm wondering if everyone can share just one strategy for advocates going into this difficult budget year and how we stay working together. Maybe we'll start with Megan. We'll just go down the line.
Sure. Thanks, Yasmin. I think what comes to front of mind for me is how do we work together to elevate the voices of those with lived experiences? How do we engage older adults and people with disabilities to share their stories, the challenges and the successes?
Monica?
Yes, the work that, you guys hear me? Okay, perfect. Continuing to meet with and partner with our legislators regarding our concerns, but the word that came to me was unity by way of collaboration, that the more we know about what we provide within our different organizations, the better we can service and offer those that we're helping, which are the older adults within our community. So yeah, collaboration amongst each other.
Dan?
I would say, in the great words of the former speaker, Tip O'Neill of the Congress, all politics is local. And that means hitting your legislators in their local district offices. These are underused, I think, by advocates. They think that everything has to happen in Sacramento, but a lot of our advocates, will find it more convenient to travel to their nearby district offices of their state legislators and let them know the personal stories, lived experiences of how these decisions that are made in Sacramento impact individuals.
Great. Kathleen?
I agree with what all of my colleagues have highlighted. I think the one thing I would also add is it's great to have data, and we're fortunate to the state CDA funded a wonderful study on the LGBT aging experience of Californians. And I think really combining data with stories. So as Megan, I think, was saying, the lived experience, letting advocates who are community members speak and tell their stories and why the services are so vital.
And so White?
I would say that, and a strategy that we are implementing and we're super focused on, is highlighting the voice of those with lived experience, lifting up their voices, and so allowing them to share their stories before the legislature and all decision makers.
Great. And the final thing that I'll add is that we are in a time crunch. When the May revise comes out, there will be about a month of heavy advocacy before the budget gets finalized. And so my tip and strategy for advocates is to stay vigilant and stay involved, because things will move very fast. And so to the extent that you can stay involved, come to hearings, make your voice heard, it's all very important, because oftentimes the people that are loudest in the room are the ones that get spared in these difficult budget fights. So with that, I will turn it back over to Kevin. And thank you so much, everybody. And thank you to our group of panelists.
Thank you, Yasmin. And thanks to that wonderful panel. Really appreciated hearing you talk about the need for advocacy right now and the best ways to do so, and also hearing about many of your priorities, the issues that we should all be working on together. I thought that today's morning session, this kind of ends it. I thought it was really insightful and interesting. We heard from a wide variety of speakers, from the administration, from the legislature, from advocates. And I thought each of those speakers brought a lot of interesting insights and information for all of us into the room and into our space together. We heard about the master plan for aging, of course, and progress to date, as well as a vision for what can be worked on next. We heard a lot about care and caregiving and home care and long-term services and supports. And we heard that that's a real focus of the Department of Aging and a real focus from lots of the advocates we heard from, and from the administration as well. Kim talked about care as being a pressing, if not the most pressing issue in California right now. We heard about affordability in long-term care, but also in other parts of the state, in other parts of our lives. And that triggered discussion about the issues of home care, or not just home care, but housing and homelessness, as key issues that are sadly becoming more and more relevant to older people in the state as affording housing becomes more and more difficult. And then we heard a lot about the budget and how our efforts to make progress in these areas have been helped by a positive budget, but now the situation has changed. And I was hearing today pretty clear messages from the administration that we should expect proposals for there to be cuts in the governor's May revise. And then we heard from the advocates talk about how we can all be working together to fight back against any cuts to programs and services that older adults rely on. So a lot of work for us to do together now and in the, like Yasmin just said, especially in the next month around the budget, but also in the months and years that follow, because our needs will only ever be met in our communities if the funding is there and the support from our elected leaders is there for those needs to be met. So lots of work to be done. That concludes our morning session. We're now going to take a lunch break. I want to talk to you a little bit about things you can do during the lunch break and then after the lunch break. So during the lunch break, please take the opportunity to revisit the lobby. There you can view the legislator messages. You can see information from our exhibitors and sponsors for today. I want to thank our sponsors and exhibitors that make this event possible. Then we'll start an advocacy program at 1 o'clock, and you can get into the advocacy room as early as 12:45, but the program will start at 1 and it will go till 3. During this portion of the program, we're going to bring together legislators or their representatives with Senior Rally Day participants, and each presenter is going to have an opportunity in the program to speak about a bill or a budget request that they're sponsoring this year. Each presenter is going to get about 10 minutes to do so. The schedule for the advocacy program can be found in the materials tab on the toolbar of the Senior Rally Day lobby room. So if you go to the lobby room, you'll see a little toolbar, go to materials and advocacy program schedule. In the document there, it'll identify which legislation and budget issues are going to be talked about and by who. So 12:45, come back to navigate to the advocacy meeting tab on the toolbar on the main lobby page. Click the link in the center of the page and it will take you to the advocacy program. So as soon as 12:45, you can go to the advocacy meeting tab on the toolbar of the main lobby page, click the link in the center of the page, and it'll take you to the advocacy program. That'll start at 1. I'll see you back here at 1. I'm going to do a little opening there, but then you're going to get to hear from lots of other legislators, their representatives, and advocates that are working on important issues. Thanks for being here this morning. Thanks to all of our speakers. Thanks to our sponsors. Thanks to the California Senior Legislature. We're off to a great start, and we'll see you at the advocacy program at 1 o'clock. Thanks.